Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop IT band syndrome or iliotibial syndrome. But before we do that, we need to understand what is the IT band, where it's attached, the causes, the risk factors for having IT band syndrome, and then we'll go over the steps that you can take to help relieve or stop IT band syndrome. So first, what is the IT band? It's a band that attaches all the way from your hip to your knee. And you can see it here, part of the attachment to the iliac crest on the top here, and the tensor fascia lata right in here, and going all the way down to your knee, to the outside of your knee. And usually your patient experience pain around this area where it's attached. Some patient could experience pain here. So you can see here, this is the bone where it's attached to in the tibia. It's called grady tubercle right in here, and I can show you here in the model. So the front of the knee, it's look like this in this model here. So this is the fibula, the tibia bone, the femur, and your knee. When you flex and extend, it goes up and down like this, and you have the IT band is attached here. So it's kind of crossing the knee joint. And when you have a tightness or fascia restriction, scar tissue in the IT band, that will limit the movement of your knee. And the problem is because it's attached here to one side, from here all the way to your hip, it's gonna pull the knee to that side and cause imbalance in the muscle and cause knee pain and could cause more wear and tear on the lateral side or the outside of your knee in here, as you see here. So attach all the way here. So this band should be nice and loose, not tight. So when you bend your knee, it will kind of evenly the way distributed on the both condyle of your femur here. But when you start to have IT band syndrome, it's kind of like shifting or moving everything to the outside of the leg and start to experience some pain in this area. So what are the symptoms of the IT band? Well, it's actually inflammation. It's inflammation in the outside part of the knee, and also you will experience knee stiffness, decreased range of motion in your knee, so not able to extend as much as you can, or it's very stiff when you bend it. So some patient could experience aching, burning, stabbing pain. Sometimes you might feel a clicking or popping in your knee or around the IT band area, and when you palpate the IT band, you will notice that there is a lot of like nodes, or that's usually a scar tissue. You feel like grinding around the band, and that's very typical with inflammation and building scar tissue in that area. So inflammation outside the knee because it put more stress on that area, and knee stiffness. So the causes of the IT band syndrome. One of the main causes is running. If you have tight IT band to begin with and you start to run and do like sports activity that require running and jumping, that will increase your risk of having IT band syndrome. If you have muscular imbalance between your quads, your hamstring, and your hip adductors, that's if your hip adductors are weak, your IT band gonna pull more, try to compensate for that weakness because the hip adductors attach on the inside and the IT band is outside. So that's gonna be causing compensation and cause more strain on the IT band. Another risk factor is if you have bowed legs. So if you have your legs is like curved in by your knee, and you see those patients like instead of their legs is straight like this, they will be bowed like this. So that's a risk factors. If you have a knee arthritis or leg length discrepancy, that's another risk factors or could be causes. So the other reason is weak glutes and hip muscles, which are actually related to muscular imbalance, that the IT band compensate for that imbalance. So how we treat the IT band? In order to answer this question, we need to understand the healing cycle and what is going on inside the IT band in relation to the healing cycle. So we'll be able to answer this question. So our body has to go through 3 stages in order to heal, and you can see it here in the image. The first stage is inflammation, swelling, redness, the blood starts to rush to that area, and you start to have pain, decreased function. And actually, by definition, it's an inflammation actually. So you start to have this inflammation, so internally you have that inflammation. The second stage of healing is a proliferation state, and that has to happen in order for your body to heal. So when you have a strain or micro tear in the IT band and inflammation, your body has to build a scar tissue to heal. That's part of healing. So during the proliferation stage, there is actually a cascade of events like fascia restrictions, muscle spasm, trigger points. Perfect scenario, actually during the maturation stage, your body should get rid of everything in the proliferation and the inflammation and clear up everything, like as you see here in the image. But the problem when you have chronic IT band syndrome, you're usually going back and forth between inflammation and proliferation. You have a lot of tightness in the IT band, and you have a lot of inflammation, and when you palpate you will feel like there is not grinding sound, and that's indicative of the scarring in the IT band. Why could be an issue? Because IT band, you should have some flexibility in the IT band that's moving like this, like a rubber band. But I'm exaggerating with the movement, but you have to have some flexibility there. But when you have a scar tissue, it's like you have a knot in the band. So when you need that movement, you're losing that range of motion. When that happens, it's actually put a lot of stress where it's attached, which is right here, and that's where you start to have inflammation and more scarring because it's pulling everything toward this bone. So how to treat the IT band? I'm gonna go over a few of the non-effective treatment just initially, so you don't have to waste your time on it. And I will relate this to the healing cycle, so it will make sense why this treatment based on the study does not provide long-term. So the first thing that commonly used is ice or heat. And when we look at the healing cycle, ice is temporary decrease inflammation, just does not provide long-term, but does not do anything for the proliferation stage, the scarring, which actually causes more limitation in the IT band elasticity. So the second thing that commonly used is electrical stimulation. It provides temporary pain relief, but does not really do much to the inflammation and proliferation. So the other option that a lot of providers use or athletes, foam roller or massage. Based on the studies, foam roller and massage provide temporary pain relief. There is no long-term result from them. And when you have inflammation from the IT band, if you rub against it, you're gonna inflame it more. So we don't want that. And I will show you when I go over the fascia system why massage and foam roller actually based on anatomy, it's impossible to release scar tissue or deep scar tissue, deep fascia restrictions when we go over the anatomy of the fascia. The other thing that's used, like joint mobilization or adjustment, based on the study, it provides temporary pain relief, but when you look at it, you moving the joint, that does not really do much to the scar tissue here and the tightness here. That's basically doing something totally different. That's why the joint mobilization does not provide long term. The other thing that's commonly used is stretching. The problem with the stretching is, based on the study, stretching causes inflammation. And think about this way, if you have a knot in your IT band and you keep stretching and you have a micro tear there, if you overstretch, you're gonna tear it more, cause more inflammation. So that's why I don't recommend the stretching to my patient. There's actually safe alternative option than stretching, so I don't recommend it to my patient. I have a video on why you should not stretch in general in my YouTube channel. The other thing is strengthening exercise. We need to do that, but we need to do it in the right time, because if it's inflamed during the area that you have, the time you have a lot of inflammation, you might cause more inflammation. The better than strengthening exercise is function training, and we'll go over that at the end. So what should we do to really treat the source of the problem? We have to work on the inflammation and the proliferation stages simultaneously. So what I personally do for the inflammation, if you have acute IT band syndrome, take a rest for 5-7 days, take it easy, don't run, and usually with minor IT band syndrome and inflammation, that should be good enough to really get back to normal. So if you have moderate to severe inflammation there, I usually be aggressive to really break that inflammation vicious cycle. So what I personally do is I use the MagnaHeal. It's a very strong magnet. The range of it is about 3 inches, so it can penetrate the body up to 3 inches. That's what I use around the IT band to decrease the inflammation. So the other thing I like to do for inflammation is to put my patient on anti-inflammatory diet, because certain food that actually could cause more inflammation and slow down the healing process. So, and lastly is it's extremely common with the patient that have chronic inflammation, especially severe inflammation, and their body going back and forth between inflammation and proliferation. They might have vitamins, mineral deficiency, and that is very essential for healing. For example, you need, like, for example, vitamin B, C, D, magnesium for your body to transition from the inflammation stage to the proliferation stage and then the maturation stage. So if you have those deficiency, your body is not gonna move smoothly, and you will be stuck between inflammation and proliferation. So that one of the things you can do at home actually is to take advantage of ASTR. It's a free online medical evaluation that can help you to figure out what kind of vitamins, mineral deficiency you might have, and slows down your healing and cause you to be going back and forth between inflammation and proliferation. So the other thing we have to address simultaneously, especially for the IT band syndrome, because it's not only inflammation here around this area or the IT band, there is always a lot of scar tissue, a lot of tightness in the band. And when you palpate it, you will feel that it's like a grinding feeling, rocks, or like a very tight band. And that's because there's a lot of scar tissue usually built up on that area. So what I usually do for the proliferation stage, I use the A3 to work on breaking the scar tissue, especially the superficial scar tissue. And then I use the A5 to work on breaking down deep scar tissue, trigger points, and fascia restrictions. So we have to work on everything in the proliferation stage to really transition it to the maturation stage. The other thing that extremely important to address is the fascia system. And briefly, I will go over the fascia system here because it has significant effect on the IT band syndrome, and it's unfortunately overlooked by a lot of healthcare providers. So briefly, I will explain the system here. So hopefully that will help you to appreciate how complex the system and how important we have to address that simultaneously. So for the fascia system has the superficial layer. It's like a wrap surrounding the entire body. It's like a Spider-Man suit that's wrapping the entire body. And you can see it here in the image, the white tissue here, that's a fascia, the fascia layers. And actually the body is divided to two big categories of fascia, the superficial layer and the deep fascia layer. The deep fascia layer in the muscle divided to 4 subcategories. So the apparatic fascia layers that wrapping a group of muscles, and then we have the epimysin that wrapping the entire muscle, and then you have the premiysin wrapping a group of fibers, bundle of fibers here, and then at the end we have the endomysin that wrapping each individual fiber. So I'm going over this because it's a very complex system, and it's extremely important to address all these layers. We cannot pick and choose which layer to release and leave the other layers. And that's why I mentioned that massage and foam roller is not going to be effective to really go deep enough, because with the foam roller it's very superficial, so you're not going to get to the epimycin, premiycin, and endomycin. And with massage, even if you use your knuckle or your elbow, that's not very pointy enough to really go deep as the A5, and that's what I like to use for the patient that has IT band syndrome. To make things more complicated, for each of these layers has 1 to 2 subcategories. So for example, the apparatic fascia layer have 2 to 3 sublayers, and the epimycin has 2 to 3 epimycin layers. And that's why the treatment has to be releasing all these layers. So otherwise it's not going to be effective enough to really release the whole fascia system. So what I personally do is I use the A1 to release the superficial fascia layer and the apparatic fascia layer, and I use the A5 to release epimycin, premiycin, and endomycin. So to summarize what you should do at home. So basically, if you are in acute stage of IT band syndrome, the best thing is you stop the repetitive motion that aggravate it, like for example, running. If you stop for a week and take it very easy, that should be good enough if you have a minor inflammation, minor IT band syndrome, to resolve by itself. If you still have issue, that's a sign that you have moderate to severe inflammation and your body going back between inflammation and proliferation stage. To break this cycle, you have to work on both ends at the same time. A lot of IT band patients, most of their issue is actually relevant to the proliferation stage. A lot of scar tissue, a lot of fascia restriction, a lot of muscle tightness and trigger points, and they might have some inflammation. So I will personally go address those issues, this inflammation stage and the proliferation stage, simultaneously to get to the root cause of the problem or relieving the IT band syndrome. So if you have any question, leave it in the comment below and I will answer it in a future video, and we'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.